has taken part in this poll. Thank you.
Yes. Thank you so much, Doctor. Okay. So let's actually dive into the session now. So as I have said already, it is about the critical incident analysis when every turn matters a lot, because positioning the patient and positioning them with the appropriate in maintaining the appropriate timing and positioning is all very important when it comes to a patient who are really dependent on us. So here we are taking learning from the patient. We are taking an example as a stroke patient. So starting with the phone call, here is a nurse who is ringing up to a doctor. So she's starting to say a problem statement saying like, we have a problem, doctor. So it is about a 72-year-old patient, day 5 post-admission. So patient have developed stage 3 pressure injury, and what went wrong. So about this phone call. So it is actually, to analyze the problem, to analyze any incident, it is about like you have to take a proper pathway. So it's about a journey through critical analysis. First, we have to identify the problem statement. So what actually happened? You can see a list of, questions here, which is like, in the middle of the slide. It's about like what, where, when, and who have involved, why it have happened, and how it have happened. It is like, it is all list of questions. I could probably see five W and 1 H. Okay, so you have to identify what really happened, real problem statement, when you start up with the critical analysis. And the second thing, when you find a real problem, what happened, the real problem statement, then you have to go on with the root cause analysis. That is actually digging deeper by asking why. So about this root cause analysis, there is a even more deeper understanding in the future slides, which will be given by Dr. Pari. So in the root cause analysis, you have to ask list of questions of why, and at the end you will understand what is the exact cause for the reason behind this problem. There is even more deeper understanding in the future slides, which will be given by Pari. So in the root cause analysis, I can hear my voice back. I think some tech issues. Yeah. So I'm sorry for the interruption. So once the root cause analysis is done and you have found out the cause behind, after doing the cause identification, you are finding the cause behind the incident, then you know probably what has to be done. The solution can be derived by implementing the sustainable changes. Why it is sustainable changes? Because you should not bring out any solution with the temporary measures. It should be a permanent measure, sustainable, and that measure should be like based on the evidence based, based on the standard guidelines. You should bring up a solution, and the implementation must be like permanent one. So this is the made a like very precise journey when you're doing a critical incident analysis. So here meet our patient. So he'll be throughout our webinar. So this is patient Ravi, where in the previous slide we were talking about a nurse calling to a doctor reporting about a patient. So he is the person behind the incident. So he is Ravi Kumar, 72 years old. He is a retired teacher, and he is a known case of ischemic stroke with left-sided hemiplegia, and he have admitted in the hospital through emergency department. So initially the patient was stable in the hospital, progressing well with the physiotherapy assistance. So the incident, what actually happened here. So on the day 5, when the nurse went for the routine morning assessment, she found a lesion which was like 4 centimeter length and 3 centimeter of width. So now there the lesion was present in the sacral region, and almost the lesion have it was like stage 3 of pressure also. So now the patient has no pain due to sensory impairment. So that's why patient have not complained either. And family is so distressed now, and the care team equally concerned about the patient now. So what actually has to be done for this? Can you please take us through that, Dr. Pari?
Yeah, thank you, Stella. So basically, this is something which happens when a patient gets admitted. The patient doesn't have a pressure ulcer, but during the admission, many patients develop pressure ulcers. So this is what we are looking at in this particular patient also. So do you want me to present, or you can?
I can switch over the slides, sir. I
Okay,
can.
yeah, yeah. Go to the next slide, please. So most often when you write an incident report, it is a quality team which gets into the investigation mode, and of course it involves all the stakeholders, including the nurses and other people who are involved with the patient. So here normally the brainstorming session happens, and very important is to make the problem statement, and then you need to get into the root cause analysis. So why is the problem statement important? Is because unless you write the problem clearly, then actually your root cause analysis may go astray. So can I stop here and ask the audience to write the problem statement in the chat box? Can you still get back to the case's history, the
Yeah.
previous slide?
Sure, sir.
So this is the case history, which is there. Yeah, this slide shows the case history. So based on this history, before doing a root cause analysis, what will be one sentence you will write as the problem statement for your root cause analysis? So please type that in the chat box and drop it there, and we will discuss it.
Yes. You can start, answering in the chat box as sir have mentioned. Failure to recognize early, insufficient turning, patient develops stage 3 pressure injury, and how the pressure also occur. Happy. Okay, hospital acquired pressure injury. No back care. Poor observation and lack of positioning. Thank you so much. Position didn't change too hourly. And failure of routine. Okay, back care. Okay, poor observation, poor nursing assessment. Okay. Okay, lack of handing over. I could see one different answer. And sensory impairment should be the focus area. Nutritional assessment. Okay. Thank you so much for
Thank
all
you.
your response. Yeah.
Thank you for that response. So one of the things is it's very, very important when you write the problem statement is to write the because for lack of time I said just write in one sentence, and I think all of you did very well. But actually, when you talk about the problem statement, you need to state the what happened clearly. So you need to say, here is is it a 72-year-old gentleman who had a stage 3 pressure injury. So that is the statement. And now what is the expected standard in your hospital? What is your expected standard? Do you expect pressure injury to happen, or what is the benchmark you have? So all hospitals want to have zero, pressure, injuries or pressure ulcers in your hospital. So whenever a pressure injury happens, it becomes a very important point, and you need to also tell that what is the impact it had. So on the patient and on the general care. So here is a 72-year-old gentleman who was admitted with stroke, and he developed a pressure injury. And if you can say that your standard was the 2 hourly turning, you could put that in spite of 2 hourly turning, or was the 2 hourly turning missing. So that also becomes part of the problem statement. Okay.
Yes.
And if you say in spite of the 2 hourly turning, then it means you have met the standards. But if you have not, then you should say probably because the 2 hourly turning was not maintained properly. So that whole thing is a problem statement. So the problem statement is not only the problem to the patient, but what you think caused the problem. That is not the root cause analysis, but that is where you start. Okay, so that is very important to think about. So next slide, please. So this again, you can't write it as a part of, the incident report. The many hospitals I find, not only the incident report is there, even the root cause analysis is sometimes written there. So the incident, as we discussed in the previous webinars, is only to discuss how the incident happened, where it happened, all those, just the details about the incident. Then when you meet together, you brainstorm, and first you brainstorm the problem statement. And that is how you start the root cause analysis. Next slide, please. So the root cause analysis, again, we have discussed this in several times during the previous webinar. So this time we are not explaining what is root cause analysis and how to go about it. So basically, the reason for root cause analysis is to stop this blame game. So immediately what happens when an incident happens, you start finding a scapegoat and start, shouting at them. So now the whole process is to write an incident report and await the root cause analysis session. So till the time, you assume it is a systemic cause and not an individual cause, and the focus is on system improvement. Next slide, please. So we will, in this case, we will use the 5 A's technique as, starting with the problem statement, as I said. So why did the pressure injury develop? Next. Because of prolonged pressure. So why was there prolonged pressure? There has been inadequate position changes. Why was there inadequate changes? The turning schedule was missed. So somewhere along the line in the case sheet, the turning schedule was not included. And therefore, this was not done for that particular patient. And as Stella pointed out, this is a patient with stroke. So the patient, even though he developed an ulcer, he did not complain of pain till another nurse did a routine assessment. She did a routine assessment and found out that it is already progressed to stage 3 pressure ulcer. And when we discussed why there was this turning schedule, then in the discussion we found out the communication breakdown. Basically, the handing over when it happened 2 days ago, this particular turning schedule was not discussed and therefore it was missed, and that continued for 2 or 3 days. So actually, the root cause was actually the missed important handing over which did not happen 2 days ago. So that is the root cause analysis. So this is how you use the 5 why analysis to get to the root of the problem. Next slide, please. Now, I'm not actually going to do a classical fishbone analysis like man, material, and all that. So once the team discussed why there was this communication, that is the handover, they found that there is no standardized handover. Each person who leads the handing over does the handing over in a different manner. So there is no structure to it, and therefore that was one of the reasons it was missed. And there is no accountability for the turning schedule. So okay, it is not in the handing over. Why did not the nurses do the turning in that particular shift prior to this being discovered? So nobody is really accountable. Everybody was saying, no, yeah, I thought the other person will do it, and that this is the usual somebody nobody, that sort of thing, story which goes on. And because there was no documentation, the nurses were expected to remember to turn every 2 hours, which is very, very difficult because you already pointed out there are staff shortages, and therefore it is very difficult to remember unless there are some alerts or reminders or some sort of documentation is there. So when they went into the root cause analysis of why communication breakdown happened, so these are the causes which came out. So you can understand that it is, though we talk RCA kappa, if you really sit and do a brainstorming, several causes will systemic causes will come up in the discussion. Next slide. So finally, it was, thought that particular day the senior nurses was on leave to a public holiday, and therefore, a junior person led that handing over, and therefore this was missed because again, there is no structure. It was the responsibility of the senior nurse to remember this and tell the nurses that this has to be done. This again is not a very smart process. And as we already pointed out, the patient appeared to be comfortable because he had a stroke and he could not feel, the loss of sensation was there. And the verbal, the handing overs are all verbal. There is no documentation of the handing over. And more importantly, in a patient who had a stroke, the family was not actually educated that this patient has to be turned secondarily. If they had been educated, at least they would have asked why the patient is not being turned. So there's a lot of contributing factors which came up from the root cause analysis, and each one of them needs to be addressed. So as we discussed earlier, once a lot of causes comes, we need to prioritize. So when you look at all these causes, we need to prioritize. Senior nurses going on leave on public holiday, you can't do anything about it. You can't cancel the
Yes.
leave, right? So maybe family education you could prioritize, or it could be documentation of handing over is
Yes.
prioritized. It's totally up to you. Each hospital, the incident management team has to decide what to prioritize and put those things first and keep implementing the changes which will prevent these sort of pressure injuries happening in the future. Next slide, please. Okay, so let's get into actually, what is the importance of turning and how pressure reduction prevents ulcers. So 2 hour, why is this 2 hour? So the 2 hour position changes is the maximum interval for high risk patients. So many studies have shown patients develop pressure ulcers even as early as 30 minutes after in a particular position. It all depends on how sensitive the skin is and how so many things, the nutrition level and all that. As a surgeon, we have found even after 1 hour hernia surgery, patients developing pressure ulcers. So that is how quickly pressure ulcers can happen. So, but to be practical, studies have shown that every 2 hours we need to do the position changes, because if you don't do that, beyond that, the risk of getting pressure ulcer goes up exponentially. So that 2 hours is the time which you need to, ideal time you need to turn the patient. And if you do pressure reduction, turning is one of them. There are so many other mechanisms. We are not going to go into detail. But in turning, a 30-degree lateral positioning reduces sacral pressure by almost 70%, 67%. Simple thing of getting them off the back. I'll also show you a map of pressure mapping, which shows how the pressure in the sacrum is so high. And if you do structured skin assessments, now all of us do skin assessment. What is it called, Stella? Is it Morse or
It's Braden.
Braden? Oh, sorry, that is the fall risk, isn't it?
Yes.
Yeah. So the Braden is the very famous pressure ulcer risk scoring, and most hospitals follow this. And if you do it religiously, according to the protocol, 40% reduction in pressure ulcers happening, and also a multidisciplinary approach, as we see in any sort of quality improvement, almost 50% reduction in improvement in the outcome of the patient. So that's what the science tells, and this is the evidence. And the main message here is the 2 hourly turning schedule. Next slide. So we thought of putting an acronym which is very appropriate here. Turns. You're supposed to turn. So what are the things you have to remember? So T stands for time-based schedule. As I told you, every second hourly. Yeah, keep clicking, Stella. So
Yeah, yes.
every 2 hours. And U is understanding the risk factors. I already told you, at admission, every patient who comes to an hospital to get admitted should have the Braden scale assessment. So you already know whether they are low risk, moderate risk, or high risk. So that is a U, it stands understanding the patient risk factors. And R is repositioning using the 30-degree tilt. So you need to tilt them, put pillows to make sure they don't again fall back on the sacrum. And this 30-degree tilt, as evidence shows, reduces the sacral pressure. And N is documentation. Note and document what is the intervention done. So what is not written is not done. So you need to document to make sure that in future, even the patient develops ulcer, you can prove that you already have done these interventions. And every time you turn, you need to do a quick skin assessment. You don't need to go to Braden to do it, but you
Yes.
do a visual skin assessment to make sure that the skin is all right, there is no erythema and things like that. So that is how this acronym turns will help you remember time based every 2 hours based on the patient's risk factors, reposition at 30-degree, note on document, and do a quick visual skin assessment every turn. Next slide. Okay, so once you have found a pressure ulcer, so there needs to be the immediate correction. So you need to, for stroke patients, some protocols say that you need to do hourly skin checks. It all depends on your hospital policy. So if that is, because I told you this, even for normal people, that is, I'm talking about anesthetized, people and people who have pressure ulcers, it may be much lower than 2 hours. For normal people, it is, 2 hourly. But for anesthetized patients, meaning whether they have stroke or they have general anesthesia, so that they can't turn on their own, it can happen much quicker. So that is why some hospitals insist on an hourly skin check. And mandatory documentation, visual positioning aids, we'll talk about this in the next few slides, and multidisciplinary injury rounds. All these things should be put in your fall prevention or, pressure ulcer healing protocols. Next slide, please. So here are some preventive actions. So one is the electronic turning schedule with alerts. What is this? So basically, this is helpful in two ways. It can be implemented. No, go back, please.
Yeah.
So one is if you have an electronic medical system, then some of the EMRs have this feature where you put the time of your assessment, and automatically that is preset to give you an alert the next 2 hours. Suppose you say at 8 a.m. you have repositioned the patient and document that in your EMR, automatically you will get an alert at 10 a.m. A beep will go saying this patient needs turning. So this is the electronic turning schedule. Some beds also come with this functionality. Just like now car seats, if a passenger sits only, you will get the car belt alert. There is a weight
Okay.
sensor there, right? In the car, you would have noticed in the newer cars, in the models which have been released last year and this year, normally, if there is no passenger, the car seat alarm, the car seat belt alarm will not go up. But when some passenger sits only, the car seat alarm will go up. Seat belt alarm will go up. So this is the pressure sensor which has been put in your car seat. Similarly, such pressure sensors are now put in the beds. And when there is a change in position, that pressure sensor detects it. And then it remembers that time. And 2 hours from the time, it will give an alert. So we have smart beds now, which with alerts, which will help you to turn. So these are all aids which help a busy nurse to remember to turn the patient. We already talked about family education program on positioning. Tell them that every 2 hours it has to be turned. Patient has to be turned, and they'll remember and remind you. And another thing is doing the monthly incident analysis. How many people have had pressure ulcers, and then that will give you a some sort of thing to do that. And you can also measure the competency-based staff training model. How many of the staff have actually been trained to do this? and how many of them do this turning properly so that the pressure is relieved. So all these have to be monitored and documented. Next slide. So this is a very, very low cost, low tech visual reminder, which you can put up in the bed in a patient who needs to be turned. So, 12 o'clock, turn the patient on the back, 2 o'clock, right side, 4 o'clock, left side, again 6 o'clock on the back, 8 o'clock, right side, 10 o'clock, left side. Simple. So you can, if you want, you can put this in the chart and put a check box, and this will work. You don't need to buy expensive smart beds. Even this very low cost thing also works. Next slide. So this is the, I talked about the smart bed sensors, and there are mobile apps which can be connected to this. The other thing is the pressure mapping. I already talked to you about. Here you can see that in the, I don't know, you need to just show that in the, the 0, 30, and 45. Yeah, this is the position of the bed. Here you can see the patient lying down flat. And the red is the very high pressure, the blue is the lowest pressure. So when the patient is lying down, there is not, so this is the head end, okay? The right head is on the right side and the foot is on the left side, okay?
Left. Yeah.
So you can see the sacral area when the patient is lying down doesn't cause much pressure. But when the patient bed is elevated to 30, you can see how the sacral area is getting red, and 45, it becomes very intense red. So not only the position of the patient, but how you position the patient in the bed matters. So that is why these pressure mapping sensors, some of this I told you, smart beds have this pressure mapping sensors, which can actually alert which position actually is best for the patient. Providing, again, stroke patient, you can't put them flat because the risk of aspiration. So you necessarily have to put them either on 30 degrees. So there is, very high risk of, and you can also know where the pressure is more, so that in addition to turning, you can put the, devices which will offload the pressure from these areas. So that is why you do the pressure mapping. And alert systems we already spoke about. Next slide. Now, you need to monitor now NABH is insisting on KPIs. The 6th edition, it's all about KPIs. I'm sure many of you would have already started, complaining about this, and clinical KPIs also has come. Every specialty doctor has to monitor. Similarly, the nursing KPIs are going to, are also in vogue. So here is the KPI for pressure ulcer. So one we usually do is pressure acquired injury rate. This is we have been already doing for NABH 5th edition itself. Time to skin assessment, 4 hours is no longer the target, it is 2 hours. So please go and look at your SOP and make it 2 hours. And how many times this target is met is a very, very important KPI. See, these are all passive KPIs. This is not telling after the event happened, this is what you want to do on the left side. Whereas these two are very important. Now you want these to be as close to 100 as possible, right? So the turning schedule compliance is close to 100%. And staff competency rates, that is their skill in offloading the pressure. You can list what are the skills they require, not only turning, but on the risk assessment, using the proper offloading devices, all those things are skills. So how many nurses know these skills? So these KPIs should be monitored, and this should be fed to all the nurses on a regular basis so that they are aware where they stand. So very important to do this KPI monitoring. Next slide.
Yes.
Okay, I think that's what I wanted to talk about. I'll now, Stella, you can take over.
Yeah, sure. This is now, for you all, my dear participants, it's like, this is patient name, Mrs. Priya. Okay, you have to spot the risk. So day 2 post stroke patient, left hemiplegia and the Braden scale score is 14. So family requesting minimal disturbance for rest. These are the three important things about the patient. So what are your top 3 intervention priorities? So you have to say top 3 intervention priorities based on the patient condition. Patient is left hemiplegia, Braden scale score is 14, post stroke patient, and also family is requesting for minimal disturbance for rest. So it is like considering all these 3 points, what are all the interventions you do for the patient? Top 3 intervention you can drop down in the chat box. Alphabet. Comfort devices. Alphabet. Okay, you will give alphabet comfort devices. Education to the attenders. Very good. Back care. Health education to the families. Yes, because family is requesting minimal disturbance. Okay. Skin assessment. Positioning change. Good. Add bed, education to family, position change. 3 things. Very good. Reassessment. Okay. Position change every 2 hourly. And high protein diet provide. Okay. Yes, nutrition is also very important. Adequate nutrition for protein. Preventable measures like any foam dressing. Okay. Explaining about the risks, positioning. Okay. Education. Okay. Okay. When it comes to, okay, passive exercises. Okay. Back massage, assessment based on the clinical condition. Thank you so much. Physiotherapy. Okay, thank you so much for all your responses. Okay, so let me move to the next slide. So evidence-based priorities for the Mrs. Priya. So we have thank you for all your responses, because all your responses shows like how far like you are able to make a quick interventions for this kind of patient. And we would also like to show you like what are all the interventions what we have made for patient Priya. So immediate skin assessment and risk stratification for the patient. And then because the patient is hemiplegic, immediately we have to do the skin assessment, and we should know in which risk status the patient is, like using the proper tool. And then implement 2 hourly turning schedule. You all have mentioned that. And also mention the documentation. Every 2 hourly you have monitored the patient schedule, you have maintained properly. More than that, what you have observed on the patient during the skin assessment, what you have observed on the any changes, it might be a mild redness, that's fine. You have to document in your notes that saying that patient have mild redness, how much it is measuring. You don't have to wait until it is changing into the pressure injury. When the skin color changes itself, you have to document it. And family education and positioning importance, you all have said about educating the family is very important. I was very glad to look into that comment, because most of the family members, when they come and admit to the hospital, they would say we don't want much of coming inside, talking with the patient, don't disturb us or do not disturb. It's all I agree, but when it comes to the patient and high risk patient for the pressure injury, you have done all the assessments and this patient is prone for pressure injury, that's where the moment during the initial assessment itself you tell to the patient family, we'll be coming every 2 hourly once to reposition the patient, turn. And you also have to educate them about the importance of the turning schedule, so that they'll also be very alert, like why you're coming and then why it is so important to position the patient in order to prevent them from serious complications. Good, that point you all have highlighted that. And pressure relieving devices and nutritional assessment, all these things you were able to drop down in the chat box. Thank you so much. It is all expected interventions for Mrs. Priya. And you remember our patient Ravi? Priya is like during our, in between patient. Like Ravi is our older patient, 75 years old patient. Like rest of the story is like extended hospital stay, additional 14 days. patient came, just patient was stable during the time of admission and all, and after 4 5 days only patient developed the pressure injury of stage 3. So what's happened to the patient? The length of stay is extended, so it is like additionally 14 days. That is like huge stress for the patient and additional burden to the family member. And successful and wound healing achieved with specialized care, second thing. Third thing, successful rehabilitation and discharge home. Fourth things, family become advocates for pressure injury prevention, because with all the proper patient family education, if you do the proper turning schedule, communicate, document each and everything, be vigilant in all your care point, then that's where the patient family satisfaction and the patient will have a good experience when they get admitted in your hospital. So now the patient Ravi is very happy after doing all the proper analysis and treatment. So coming to the point of true cost of prevention versus treatment. The patient, same way, I was talking about the patient Ravi in the previous slide. The patient comes in the hospital with the expected calculation what they're going to actually spend for the treatment. So, but what actually happened when something like unexpected incident happens, like the same pressure injury, it is so unexpected to the family. If such things are happening, it's a real burden and additional stress to the family member, where they're going to spend more than what they have expected or calculated before even coming for the admission. It is like average cost by the research, it says like treatment cost is like 2.5 lakh for the pressure injury treatment. So by doing proper measures, turning schedules, and as sir have mentioned about many digital touch points on digital beds, and then alarm system, all those proper communication, standard way of documenting pattern, all those things, if you're following it up, we are going to prevent the pressure injury. We cannot eliminate, but we can still strive hard to set the benchmark in our healthcare. No less than 2% of pressure injury in your own hospitals, and you don't have to report many as incidents saying that more pressure injuries in your unit. So we all wanted to strive together to do all those things by using a proper modalities what were mentioned in this webinar. So what we have learned from Ravi's case is like system thinking prevents the individual blame and system failure. Do not aim to blame the individual. If you are going to blame the individual, then the incident reporting is going to get reduced in your hospital. If incident reports are too high in the hospital, it means everybody is transparent, happy to report the incident, and they are ready for the system change. If they are not doing, if your hospital, anyone is saying you don't have any incident in your hospital, it means the blaming culture is so high, that is why they don't want to come up with any system change. So promote the culture, like you encourage the individual to report the incident, and proactive prevention like cost less than reactive treatment, and team communication and documentation is very important, which actually plays a major role in the patient safety aspect. And the last thing is like continuous learning transform incident into improvement. It's not a one-time learning, it's about lot of digital innovations are coming, lot of system changes are coming. You have to upgrade yourself to make something different and give a lot of patient experience to the in the healthcare. When they're coming admitting in the hospital, they have to go back happily from the hospital without any harm. So this is the key takeaway out of this webinar. So call to action is like conduct pressure injury prevention audit this week. So this is actually a possible call to action. Like you, there may be like senior most nurses or senior more healthcare professionals who are in this team and attending to this webinar can actually take this into consideration, and you can do this. Conduct pressure injury prevention audit this week, and then implement turns framework in your unit. So and then share learnings with your team. And also join Skills for Med community for ongoing support. So this is the call to action, and we have come to an end. So I have two announcements. One is on the display, that is about August 29th. We have the nursing leader who is coming up. It's still in the surprise mode. You will be seeing who is coming, and then that's the topic will be as inspiration and insights from nursing leader. It's going to be very interesting. I looking forward for that session. And also another announcement, last week webinar we were telling we are gonna to distribute the handout resources post webinar session. So for the last week, the handouts are very it's ready. Actually, I had to say the handout must be like we feel that handout should be like very useful, and it should be act like a ready recurrent for you all. So our team was working hard to make it good in a way so that you can actually feel some benefit out of that. So that handout is almost ready, and also for this webinar together, the handout for previous webinar and the handout for this webinar, you will be getting it when you are receiving your certificate after 3 days of from today, like probably on Tuesday or Wednesday. You will be getting that, and that handout resources, again considering all your limitations, we are giving out in a limited cost, 99 rupees. You can know the link will be provided. You will be ending up in our website to purchase it. Thank you so much, and now we are open for the Q&A.
Can you put the link?
Yes, feedback link is there.
Yeah. Thank you.
Yes. If there are any questions, you can take this opportunity to ask this question. I think one person have raised hand. Christy Babuji. Can you unmute that person? Christy Babuji, do you want to ask something? You have been enabled to unmute yourself and you can ask your question directly here.
I think there was a question in the chat box.
Chat box is there? Okay, sir.
How do we set the benchmark any formula? That's based on the hospital, right?
Yes, and also, when it comes to quality indicator, the pressure ulcer formulas are already given by the, NABH. If you go through that, the module, there will be the fixed formula to how to calculate the pressure injury. And the benchmark is also available there. So you can, probably take it from there.
You want us to repeat the turn
abbreviation?
Maybe you should go to the slide and put it up.
Yes. Just.
And for the question on prevention of pressure ulcer, I mean, that is a topic by itself. I think today's session was not about a theoretical session on that. So we probably dealt in the past, but we'll have a look at it. If it's not in the YouTube, we can do it again.
So I'll share the screen now with that abbreviation. Yes. So this is the abbreviation you were asking, and
It's an acronym.
Sorry, acronym. Yes.
Acronym is a word in which each letter means something. So that is what is called an acronym.
Okay.
So here T is time-based, every 2 hours. U is understanding the risk factors. R is repositioning, the 30-degree tilt. N is notes, that is the documentation of your intervention. And S is the visual reassessment at every 2 hours, whenever you turn them.
And let it be on the display. Doctor, can we move on with the questions which is in chat box you were telling already? Like there was one question from Ms. Bhakti Lakshmi. For prevention of pressure ulcer, is there any solution?
Yeah, that's what I was answering. That that
Okay,
needs a
okay,
separate session by itself.
okay, okay, okay,
And no, today it was about incident
okay, okay.
analysis and root cause analysis.
Oh, I'm sorry. I'm
I,
sorry. So I was
I
like,
don't remember whether we've done in the past.
yes, yes, we
Otherwise,
have done.
we have done. Yeah, then it should be in the
Yes,
YouTube. I can probably put the link in the or the YouTube video in our WhatsApp group also.
yes. We can actually check that up and then no, I can put it in the
Yeah, yeah.
yeah.
So there's no QR code to join the WhatsApp group this week.
It's there actually when we are sending mail, with the certificate, we are sharing the link for the WhatsApp group also. So you can no probably you can click that link and you can add or so that's the only way they can do it. Otherwise, we can post our WhatsApp link here in this chat box even. I can do that. Okay. So okay, post. Okay. Suppose WhatsApp link I can no do it now. Yes.
All right, Stella, can I
Yes, sir.
leave?
Yes, yes. They're
Thank
asking for the
you.
WhatsApp link so that I can share that link also here now.
Yeah, I think
Maybe.
we used to routinely put that QR code. I think you should do that.
Yes,
Quick.
yes.
Yeah. All
I'll
right.
do that. I'll do that, sir.
Yeah.
Thank you so much.
Thank you. All right.
Thank you.
Thank you, everyone.
Yes.
Bye.
Bye, sir. Thank you so
Next
much.
week. Next week is the guest podcast. So be sure you tune in for that. Thank you.
Yes.
Yeah.
Yes. Thank you so much, sir.
Also visit our YouTube. It's got no more than 60 plus videos and recordings of all the live webinars. So subscribe to our YouTube channel as well. Thank you so much. Bye.
Yes. Thank you so much. Give me some time. I'm pulling up the WhatsApp, QR to make you all to join in that community. The QR is almost ready. Just a moment. I'll put it in the last slide so that you can scan directly from the projection and then you can join over. So this is our WhatsApp group. QR code. You can no all are not there in our WhatsApp group. You can scan this QR code and then you can join our WhatsApp group. So thank you so much. So all have completed the link, like feedback link. You can know leave the Zoom room so that we'll understand like how many are pending to complete the form. Thank you so much for all your interest. And can I get the PPT still again? Know what sir have mentioned. So you can watch this webinar itself in our YouTube channel. So YouTube channel name is Skills Format. You can open that and then you can you can subscribe so that you will get all the notification related to Skills Format post. And even equally you can scan this QR code and then you can join our WhatsApp group. Thank you so much. Yes, Saritaji, once you have filled the form, you can leave the Zoom room so that you will know like how many are yet to fill the form. Thank you so much.